All right, welcome everybody to our show. This is selfprinciple.org. I'm your host, Dr. Sean Hashmi. And every single episode, I get this honor and privilege to have some of the most remarkable people who are making a difference. We talk about in the world of social media, all sorts of folks who are out there. They may have all sorts of following, but then you get real life people who, in my opinion, are heroes who are changing lives with everything they're doing. So today is no exception. I'm really delighted to have Dr. Meagan Gray on. So Dr. Gray, welcome to the show.
Thank you so much for having me.
My pleasure. So Dr. Gray is a hepatologist. She's actually a transplant hepatologist at UAB Medicine. And we are going to talk about so many different topics today, but the most important of which that I really want to pick her brain, and the whole reason why I wanted her on today was really about fatty liver. But before we even get into that, Meagan, tell me a little bit about who you are. What inspired you into medicine, and more importantly, what inspired you in this concept of focusing on food as a sort of not just medicine, but as a sort of lifestyle?
Yeah, thanks for asking that. So I did not want to be a doctor ever. I actually went to college to do some benchtop research. I thought I wanted to do cancer research. And when I was in college, I started having some GI upset and things like that. So I started looking for different ways to help myself feel better. And so that's sort of how I personally discovered a plant-based diet, was that was a way that I felt really healthy and had lots of energy and was able to do the things that I needed to do to get through a rigorous college education and medical school and those things. And that sort of sparked my interest in gastroenterology. So I actually went into medical school already knowing that I really wanted to be a gastroenterologist. And then that shifted a little bit in residency. I started working with patients with cirrhosis and liver disease. And I was lucky enough to be able to see a few patients get transplanted during my inpatient rotations in residency, which is really such a miracle to watch. Someone is so ill, and then just, even a week or so after transplant, they're walking around, their color is good, they feel so much better. So it really is a miracle to watch. And so I just really fell in love with the patient population and the ability to have a curative treatment for this really devastating disease. And so that sort of sparked my interest in transplant hepatology. And so I did my fellowships in both gastroenterology and transplant hepatology. And then as I was sort of finishing fellowship, really just everything kind of fell into place to sort of mesh this love that I have for plant-based diets and nutrition as also a way to help prevent and reverse fatty liver disease and help prevent patients from ever getting to that stage where they ever need a liver transplant. And so a little bit more on the preventative medicine side, I suppose, but I really do love getting to meet people early in their stage when the disease is completely reversible, and being able to really help them. And then, for patients who come to us later stages in their disease and do need transplant, of course, I can certainly help them through that process too. So I love being able to do the whole spectrum.
I guess one of the things that I find interesting in my field of nephrology is when people have kidney disease, they don't really have symptoms. So let me ask you, with fatty liver, first of all, what is fatty liver? And two, what are the symptoms of fatty liver that people should either know about or not know about?
Yeah, so fatty liver, like kidney disease, can also be quite tricky. So we define fatty liver as more than 5% hepatic fat in the liver. And you can actually get fat in the liver from a variety of different things. So certainly it can be foods that you're eating in the diet. We call that non-alcoholic fatty liver disease. Certainly alcohol can cause quite a bit of fat in the liver. Some medications can cause fat in the liver. So when we're seeing patients initially, we always want to make sure that we have the right diagnosis, because that's going to help us treat the patient in the best way. So I think today we're going to mainly focus on non-alcoholic fatty liver, since we both have a love for nutrition and helping patients to lead healthy lifestyles. But I have to tell you that fatty liver is very tricky. And I think as we learn more about it, we learn what a stealth, sneaky disease it can be. So for the most part, patients do not have any symptoms at all. So the way that fatty liver is most often picked up is either that they have liver tests checked and the liver tests are high, or that they have an imaging procedure for another reason and fat is noticed in the liver. I would say the most sneaky thing is that about 50% of patients who have non-alcoholic fatty liver disease will not have elevated liver test. So although it helps us if they do have elevated liver test, because that often prompts a further workup, there's a significant number of patients, about half, that will go on to develop significant fibrosis and cirrhosis and never have elevated liver test. So that makes it extremely challenging, especially on our primary care population or primary care providers and our endocrine providers who are doing their best to approach patients in a comprehensive way and address multiple different issues. When something doesn't pop up in red on the lab slip, it doesn't prompt them to do any further investigation. And so certainly we know that this can be a very silent disease and often doesn't present until the disease is very advanced.
Now, you mentioned liver tests. For those folks who are watching right now who may not understand what liver tests to look for, what are those tests and what kind of stuff should they understand or go back to their doctor and have a conversation about?
Yeah, so there's 4 main liver tests that are routinely checked. So that's the total bilirubin, the AST, ALT, and the alkaline phosphatase level. So these are not liver function tests, these are just liver tests. And so AST and ALT are enzymes that are released from hepatocytes when there's breakdown of the cell, and that can happen for a variety of reasons. So certainly liver tests can be high from a variety of different diseases. So just because they're high doesn't mean that you have fatty liver disease. It could be a variety of different things. But most commonly what we see when patients do have fatty liver disease is that they'll have an elevated ALT level. So I think it's always important to sort of know what normal is so that helps you to recognize the abnormal. So for women, it's recommended that ALT levels should be below 19. And in men, it's recommended that ALT levels should be lower than 30. And that's based on lots of data on large populations to help us determine those levels. What you'll often notice, though, is that when you look at your lab's reference range for normal, sometimes the AST and ALT normal ranges will go as high as 50 or 60. But from a liver society standpoint, those values are actually considered to be high and suggestive that there is active damage happening to the liver. So certainly knowing what the society recommends as in terms of normal levels can help you recognize more people who may be at risk.
So I think, one of the things that I hear a lot in my practice, so as a bariatrician, I see a lot of patients who have fatty liver. And when we talk about things like overall health and stuff, sometimes people say, oh, but the liver, it can heal itself. The liver can regenerate. I think it's a little bit of a misnomer, but let me ask you, what's sort of your response when patients talk in those terms?
Yes, I think you're correct that the liver is a brilliant organ and it does have a large ability to repair itself. However, it cannot repair itself from every injury. And so when we see patients, the first things that we do, number one, is to make sure we have the right diagnosis. So anyone that comes with elevated liver tests gets a full panel of workup looking for viruses, autoimmune diseases, genetic disorders, anything that could make the liver test high. And then the second step is always to determine how much damage has been done to the liver from whatever it is that's causing the damage. So there's multiple different ways to assess what we call fibrosis or scarring in the liver. So some of those can be non-invasive scoring systems that are based off of the patient's lab, such as the FIB4 or a NAFLD fibrosis score. Those are very simple scoring systems that can be used in the clinic. There's also imaging-based modalities to look for fibrosis. So there's an ultrasound-based elastography. There's also MRI-based elastography. And both of these measure stiffness in the liver, and how stiff the liver is correlates with how much scarring or damage is there. So whether or not the disease is completely reversible and whether or not the liver can completely repair itself really depends on how much damage there is. So if someone has no scarring or damage at all and they just have fat in the liver, then with weight loss, that's going to be completely reversible. For someone who has advanced scarring or damage in the liver or even cirrhosis of the liver, even with weight loss, you may be able to prevent further deterioration, but you're not going to be able to reverse all that scarring and damage that's there. So it's typically thought that if you can lose about 10% of your overall body weight, you may be able to reduce one stage of scarring. So scarring is on a scale from 0 to 4, with 0 being normal and 4 being cirrhosis. So if you start at a stage 2 and you're able to lose 10% of your body weight, perhaps you can reverse that to a stage 1, but we would not expect for someone at stage 4 or cirrhosis to ever be able to go back to a stage 0.
Understood. Now, what are some of the main causes you would say when it comes to fatty liver? And of those causes, what can people start to think about or do to sort of reduce their chances for it?
Absolutely. So any metabolic disease is going to put you at risk for non-alcoholic fatty liver. And that's a broad range of disorders. So that can be certainly being overweight is very high risk, having type 2 diabetes, high blood pressure, high cholesterol, polycystic ovarian syndrome, heart disease. All of these things, are often related to the diet. And so just like type 2 diabetes or obesity can be very well treated and sometimes reversed with diet, that's the same for fatty liver. And often the foods that cause each of these things is very similar. So there's two main culprit food groups that I talk to patients about. One, to see how much is currently in the diet, but also to help them work on ways to reduce those things. So the first is refined carbohydrates. So we do know that sugar and things that are processed like sugars do turn directly into fat in the liver. And so we talk about things like sweet drinks, especially here in the South. There's a lot of sweet tea, soda, juice, white bread, white rice, pasta, candy, cookies. All of these things fall into that refined carbohydrate category, and they're all processed the same way. Now, that doesn't involve all carbohydrates. Patients commonly are recommended to be on low carbohydrate diets or come to me already trying to follow a low carbohydrate diet. But certainly whole grains and fruits, any carbohydrate that comes in a package with fiber is very healthy and does not need to be avoided in the diet. And then the second major culprit is saturated fat. So there's different types of fat. Saturated fat mainly comes from your fatty or animal products. So that's beef, pork, sausage, bacon, eggs, cheese, full fat dairy products. And so certainly here in the South, that's a very large portion of a lot of patients' diets. And so we know that also increases fat production in the liver and increases adipose tissue to release free fatty acids, which further increases fat in the liver. So we really focus on trying to reduce those things in the diet and shifting to unsaturated types of fats, which are things like olive oil, nuts, avocados, sort of your plant-based sources of fats, which have also been shown to help reduce fat in the liver.
That's very interesting. Going back to your first point about carbohydrates, there's been such a fear of carbohydrates. And what's really interesting is all carbohydrates gets labeled as bad.
Yes.
And the fascinating part of people who look at a plant-based diet, in kidney disease, there's a fascinating study that showed there's such a thing as a healthy plant-based diet, which we call a whole foods plant-based diet. And then there's an unhealthy plant-based diet. So potato chips, for example, it's a plant-based food, yet it is one of the worst things you can do because it's straight salt, sugar, and fat. It's the three most addictive substances we have, combined with just the right formulation to go target all those wonderful brain receptors to make you have the most addictive sensations ever. So looking at this concept of complex carbohydrates, is that something in kidney disease, for example, what we tell our patients is the more complex carbohydrates you eat, which means these are foods that are rich in fiber, rich in antioxidants, that are calorie poor, nutrient dense already, just the way nature intended them, they actually do really well in terms of kidney disease. So in population-based correlation, not causation studies, the higher your intake of fruits and vegetables, the lower your incidence and prevalence of kidney disease and progression of kidney diseases. How does that fare when we talk about liver disease when it comes to complex carbohydrates?
There is data for carbohydrates and fatty liver. The trouble with a lot of the studies is that they don't define whether it's a refined carbohydrate or a complex carbohydrate. And so that makes it really challenging for us to be able to draw conclusions. We know absolutely without a shadow of a doubt that refined carbohydrates in terms of sugar sweetened beverages and candy, that those things do directly cause fat in the liver. And those studies are there. And there are studies where you reduce soda intake, where you reduce candy intake, especially in adolescents, and it does reduce fat in the liver. So that data is there. The data that is not there is for complex carbohydrates. And so we're really extracting data from other disease entities such as cardiovascular disease or all-cause mortality, these kind of things, to say that these complex carbohydrates are healthy. But unfortunately, we don't have, at least at this time, any direct studies looking at complex carbohydrates in NAFLD. There have been population-based studies that look at fiber intake and NAFLD, and certainly we see that patients who ingest higher or diets higher in fiber tend to have less NAFLD as opposed to patients who have diets very low in fiber. So we could extract from that whole grains are full of fiber, and so eating complex carbohydrates, you would think, would be less likely to have NAFLD, but that data is just not there, unfortunately.
And maybe your team will do that data, so that'll be perfect.
I hope so.
All right, let's flip it to then saturated fat. So, as you know, one side is the fear of carbohydrates, but whenever you mess with one macronutrient, you're left with two others. So in one case, people believe that a really high fat diet, and the other case is protein. Let's start with the fat side. What is your take on following a ketogenic type diet, which is predominantly a high fat diet? And what's the impact on liver physiology?
So high fat diets, so keto diets, I think we all cringe just a little bit. But I do try to have an open mind and tell patients that there may be a healthy way to follow a ketogenic diet if it can be done properly. So certainly when we think about the typical way that patients follow ketogenic diets, they tend to eat diets that are extremely high in saturated fat. So you'll hear them having a lot of red and processed meats. You'll hear them adding butter to their coffee, all of these things, which are incredibly high in saturated fat. And so we know that saturated fat increases fat in the liver, increases fibrosis and scarring. And so from that standpoint, not only in addition to the adverse liver effects, but also knowing that can increase their cardiovascular risk. For all of those reasons, we strongly recommend that patients don't eat diets high in saturated fat. There have been some people that have started to develop a plant-based ketogenic diet, and I think that can be a healthy option. So they eat diets that are extremely high in fiber because that you're able to subtract that fiber intake from the total carbohydrate intake and have sort of a low overall carbohydrate content that matches with a ketogenic diet. But then they also eat diets that are high in olive oil and nuts and avocados and these plant-based sources of fats, which have anti-inflammatory activities, which can help reduce fat in the liver, can help improve fatty acid oxidation in the liver. And so I think if a ketogenic diet is done in that fashion with lots of fiber, lots of unsaturated fat, I think it can be healthy. Unfortunately, that's just not the way that most people do that type of diet.
That's exactly what the challenge that we run into. So as part of the bariatric practice that I run, when I see patients who are coming in and they're struggling with their weights, what I find is there isn't any diet out there that they haven't dabbled in already. And the challenge that they run into is they are really passionate about diet X. Let's say it's, the Atkins style, or it is name your diet. But 6 months into it, things start to change. It starts to get harder. We talk about food as medicine, but what we forget, food is also culture. There's so many memories that we have that are done at the dinner table. And when we start to say we're going to restrict something so much, it really does make it harder to sustain that. So we talked about saturated fat. What about a high protein sort of style, low carbohydrate? Does that have any impact when it comes to liver physiology?
So high protein diets, I think that a lot of the reason that people promote these types of diets is because protein can promote satiety. And so when you promote satiety, you tend to eat less, and that helps lead to an overall calorie deficit and weight loss. So I guess in terms of liver physiology, there are concerns with red and processed meats. So the red and processed meats not only are high in saturated fat, they're high in cholesterol. They also have carnitine and choline, which can be converted to trimethylamine and trimethylamine oxide by the gut and liver. And that's the short name for that is TMAO. And we know that TMAO is associated with atherosclerosis and cardiovascular disease, but also high TMAO levels are associated with higher levels of inflammation and fat in the liver. So certainly for red and processed meats, I think for a variety of different metabolic disorders, it's well known and well associated that these meats can be harmful. In terms of lean meats, I think that data is just not there. In terms of, does fish and chicken cause the same problems that beef and sausage cause? We would presume not, because these are leaner meats, they're lower in saturated fats, but that data is not there to be able to firmly say that they're safe or that they don't cause problems. And I was going to say something else and I just forgot what I was going to say.
Well, let me ask you then, while you're thinking of your comment, as we think about this role of insulin resistance, how does insulin resistance play when it comes to meat? Is it happening simply because of the high fat content? Is it something more to do with something else in meat? Is it activation of certain pathways? What's sort of that link there?
Yeah, so I think that so often what is said is that carbohydrates cause insulin resistance, and that is not the case. So insulin resistance means that your body is not processing carbohydrates correctly, but that doesn't mean that carbohydrates cause the problem. So we know that when you eat carbohydrates and your pancreas secretes insulin to help digest those, 85% of that carbohydrate should be absorbed into your skeletal muscle. That's where it's stored as glycogen for use later. And so what happens when you are overweight, and especially in patients who have type 2 diabetes, that muscle actually gets full of fat. And so when the muscle is full of fat, that decreases its ability to absorb glucose and insulin and store that as glycogen. And so when we look at studies that show what increases fat in the muscle to cause these types of problems, the data clearly shows that that's saturated fat that causes that. So saturated fat in the muscle makes us less able to uptake glucose and store it as glycogen in the muscle. So then when we can't store it as glycogen in the muscle, that has to go somewhere. And so it goes to the liver, it increases lipogenesis, it increases triglyceride formation, which is then stored as fat in the liver. And that's the definition of NAFLD.
So what's interesting is when we look at smaller studies, whether these are animal studies or these are in vitro studies, what we find is if we expose animals to essentially a ketogenic type diet, people like to take cheat days. And what's fascinating about the data on people taking cheat days is both in animal and in human studies, you'll see that the second the sugar goes back into the system, these are people who are following a low carbohydrate diet, the body's, even in as short a time as 7 to 10 days of following these diets, doesn't know how to handle the sugar. You start to see the sloughing of endothelial cells. They literally start dying, and you can see all of these metabolites floating around the blood. And I think that's the danger with confusing a short-term diet versus a long-term lifestyle.
Absolutely.
So let me ask you then, for a lifestyle basis, for people that are watching this, what are some of the things that they can start from the beginning to try to help them?
Yeah, I think the point that you just made is the point that I always try to make with patients. And so we do know that ketogenic diets are difficult to follow over the long term. And so when I talk to patients, I really try to focus on, we're not trying to put you on a diet that is going to help you lose 20 pounds in 2 months, because at the end of the day, we need you to keep this weight off for the rest of your life. Being on yo-yo dieting and this roller coaster of your weight, that's not providing any long-term benefit for your liver. So it's sustained weight loss that's going to help the health of your liver. And sustained weight loss more often comes from making lifestyle adjustments that are sustainable. So when patients do want to talk about diets that completely get rid of a macronutrient, so no carbohydrates, ketogenic diet, or no fat, these diets are very difficult to sustain because our body needs those macronutrients. And so what we focus on is trying to improve the quality of the macronutrients that they're eating. So you can have carbohydrates, we just want you to have healthy complex carbohydrates. You can have fat, but we want you to have healthy plant-based fats. And so I think even just from a patient acceptance level, when you're introducing a diet and you're saying, we're not going to restrict any macronutrient, we're just going to focus on the quality, that is so much easier for them to understand and to think about, oh yeah, I think I could do this for the long term. And especially once they start feeling better eating that way, they're eating all these foods that are anti-inflammatory, that give them more energy, that don't weigh them down, and they start to see some of those weight loss effects from eating that way. I think that is very encouraging. It helps them to continue to stay on that path.
So everybody wants to know, how do I burn fat? Right? This is like the holy grail. And I if I had a nickel or even a penny for every person who asked me that. So let me ask you then the holy grail question. How do we, if we already have fat in the liver, and let's say it's over 5%, let's say it's 20%, what can we do to help sort of expedite the burning of fat?
Yeah, so I mean, to burn fat, you have to have a calorie deficit. And so that's what we've also talked to patients about. So doing things like tracking calories can be so incredibly helpful. So in our clinic, we introduce patients to MyFitnessPal. There's certainly lots of other different ways to track calories, but usually for most patients, about a 500 calorie daily deficit is going to help them lose weight in a safe, healthy way. And so we do have the ability to calculate a resting metabolic rate for patients in the clinic. And so we give them an idea of how many calories their body is burning at rest. And that helps us calculate a goal for them that's going to be safe to move forward. And so that I don't have any magic way to burn fat other than a daily calorie deficit. And so I think certainly patients also can run into issues with buying things off the market that claim to burn fat or claim to do lots of other things. And we really do strongly advise against taking these types of supplements because in some cases they can very seriously harm the liver.
Well, we've had such a negative track record with weight loss medications in the past, at least, where a lot of the sympathomimetics, or the ones that would speed up your system, so to speak, we found out years down the line that they were either damaging heart valves or so forth. And even more recently, we've had a medication that came on the market. There wasn't much concern in terms of damaging heart valves, but it got pulled as well. So it becomes very tricky when people look for shortcuts. But you said something really fascinating, which was, trying to do it in a safe way by trying to reduce about 500 calories a day. Well, there's two fascinating studies, and both came out of Dr. Barnard's group. And what he did was, the first trial was a randomized control study comparing a whole foods, low-fat vegan diet versus a ketogenic diet. The second one was same exact thing, a whole foods, low-fat vegan diet versus a Mediterranean diet. In both studies, the participants were told they could eat as much as they wanted, and they get all the plant-based foods that they could possibly have, no limits. And what they found was that on average, without ever knowing that this was a weight loss study, because it wasn't billed as such, they were eating on average 500 less calories per day without even trying to. And the beauty of whole foods, and especially a whole foods, low-fat vegan diet, what it does is it gives you calorie-poor, nutrient-dense foods. You get these beautiful benefits out of it. You can have, listen, if you go to, and I'll pick on a brand name, I'll say McDonald's. I got nothing against them, more power to them. But let's say you go to McDonald's and you get one of their Big Mac meals, you're getting over 1,000 calories right there. If you want 1,000 calories of fruits and vegetables, I mean, you're talking a heck of a lot of food you got to try to consume.
Absolutely. Yeah. Calorie density is so incredibly important. That fiber that comes with all of those plants is also very filling and contributes to satiety. And so that also can be incredibly helpful for weight loss.
So let's dive into the fringes a little bit and talk about some other stuff. People are always supplementing and they're always wanting to know. So Some of the most popular questions that I know I always get asked are around things like coffee, omega 3s, turmeric. So let me start with coffee. Is there any data that you would say that helps that coffee has any sort of benefit when it comes to liver, whether it's liver cirrhosis or it's fatty liver? What would you say?
Yeah, so data for coffee is actually there. So if you can drink 3 cups of black coffee a day, which I have to say is more than I can tolerate, but if you can drink that much, it is associated with less progression of fibrosis and reduced risk of liver cancer. So for patients who can drink that much caffeine in a day, which I know a lot of people can, we do recommend that. But a lot of other supplements really haven't been borne out to be as helpful as we had hoped.
And I always get asked this. So the second question to coffee is, does it matter if it's caffeinated or decaf?
I think the exact mechanism for how coffee helps is still being elucidated, but we do think that the caffeine content is part of why it helps. And so, yes, caffeinated coffee would be ideal.
All right. Now, what about some of the other stuff where the data is not that great, but people still want to know things like omega 3s or turmeric?
So for omega 3s by themselves have not been shown to have any benefit on NAFLD or fibrosis or anything like that. Now, what we do know is that omega 3s can help lower cholesterol and can help lower triglycerides. Having very well-controlled cholesterol and well-controlled triglycerides certainly can benefit fatty liver. So if you have high cholesterol, that can be a great supplement to add, but we would not add that in someone with a normal cholesterol level and fatty liver alone.
What about turmeric?
So turmeric, I think, is such a fascinating substance, I guess. So certainly we know that turmeric has lots of powerful anti-inflammatory effects. The data for whether or not it helps liver health is just not there. But if someone wants to take it, I don't generally advise against it. It's a spice. It can be used in cooking. I don't think there's any harm to taking it, but we just don't have any data to say that it helps.
What I find fascinating about a lot of the data on turmeric is there's a lot of stuff that's done in vitro studies or in controlled animal models that they've seen, even when it looks at things like neuroprotection. But what people forget about all of those studies, and they rush to the store and they buy all the turmeric has very poor bioavailability. And it makes it very hard. Now, fat helps a little bit. It increases by 4 or 5 times. And then, of course, black pepper can help a lot. But even then, the amount that's actually getting absorbed is very little. But the amount that's being used in studies, when they're giving it in all sorts of different formulations, whether they're injecting it directly or doing other things, it's really hard to replicate that. So as much as I love turmeric, I grew up on turmeric. So my background is I'm Southeast Asian, and pretty much every meal that we make, we either take the root itself and, we just cut it up and throw it in there, or it's the powder. And it's always in there. And the food it's a lot of curries and stuff. And that's what gives them that beautiful orange color. But it's a fascinating thing that the bioavailability is just so low.
I did not actually know that. So that's very interesting.
Yeah. So let me ask you now a little personal stuff about yourself. As physicians, I think one of the challenges that we have is we're in a profession where we give so much of ourselves, but we forget to take care of ourselves. And, self-principle, it's not just, it's sleep, exercise, love, and food, but it starts with us, and we fill our cup so that we can fill everybody else's cup. It's all about what we give to the world. But let me ask you, that concept of filling your cup, what do you do to, stay healthy? And what's a typical day like for Dr. Gray that, people can kind of learn from?
Yeah, I think you're right. I think when we don't take care of ourselves, it makes it incredibly difficult to take care of others. So I would certainly say that my faith is a huge part of that. From a health and wellness perspective, I do eat a plant-based diet. That's how I personally feel the best. I have the most energy. I have good sleep, and I'm able to get through my day and do all of the many things on my plate. So, I certainly understand that different people feel well eating different ways, but that's personally what's worked best for me. And then staying active. I absolutely love running. I I have a running group that I run with, and it's just always a good stress relief for me. It's something that I've always loved, just a good reason to get outside, get outdoors, explore some new areas. And so those are the things that I do.
So, I wish I could still run. I have really, my wife says I'm broken. When I was,
Oh,
when I was younger, I did a lot of martial arts and I have all of these like injuries, tons of broken bones and all this other stuff. And so I got me a Peloton, and I don't own stock in Peloton. I don't have any affiliation, but I tell you, it's become such an addictive part of my life. I feel guilty if I don't go on it.
wow.
There's you can tag people, so everybody has a tag. And mine, of course, is self-principle. So there's all these people who I know, and when I'm writing, I'll see these high fives and I'm high-fiving back. And it's like this virtual community that you don't even know who the person is on the other side. But my friends who are at my work and so forth, I always know when they're on, and they always and they call me out. If I'm not on, they'll be like, "Why weren't you on the right today?" I'm like, "Oh my God, I feel so bad." It's like it's confession time. So it's been one of these crazy joys. But I used to really, really enjoy running. It was fantastic, but it's been a long time.
Yeah, I absolutely love it. I think if I couldn't run, I would join you on the Peloton. Until that day comes, I'm gonna keep
When
running.
that comes, we will figure out your tag and we'll make sure we point that out. So speaking of exercise, what is the relationship with exercise and going back towards this concept of fatty liver?
Yeah, so absolutely. I mean, I think in general, just anything that helps you lose weight is going to help the fat in the liver. So, just for general health and wellness, 150 minutes of exercise per week is recommended. And so that's what we talk to patients about. And even if that's just getting out and walking, that is definitely better than sitting on the couch. So, you can start in small increments. It doesn't have to be that you run 5 miles a day, but just starting anywhere is a good place to start. But I think overall, whether you lose weight because you're watching what you're eating or whether you lose weight because you're exercising, either one of those things is going to have benefits for the liver.
Well, what's fascinating is in my own research, when I started down this journey of as part of my work of looking at nutrition and so forth, I started getting really fascinated about this concept of self. And I was looking at all these people that were living over 100. And what I was finding was that consistently, they didn't have any gyms. They weren't like, I got to go exercise now. It's my 20 minutes to go exercise or 30 minutes. They would just move. And on average, you would see these guys walk on average 5 to 10 miles a day. But none of them knew they were walking 5 to 10 miles a day. None of them knew. I mean, we're talking people who were over 100 years old. They're just working in the fields like it's just another day. And I find that concept that's somehow lost on us is we do every single thing to avoid walking.
Yeah, that is very true.
It's interesting.
Especially during this time of staying at home, you've probably seen it as well, but a lot of our patients have gained significant weight just from being inside their home and not walking to their office or doing, the physical labor that they would be doing at their job otherwise.
It's an interesting phenomenon, and I find it also interesting when they tell me it's because we're gaining weight because we're not exercising. Well, exercise really doesn't cause weight loss. I mean, the amount of exercise you would have to do to burn 500 calories is tremendous. But what exercise does is it helps with your metabolisms, helps to offset the slowing that's going to occur. But what we end up doing when we're indoors is we look for comfort, and food is a comfort. And I had Chef AJ on, and one of the things that Chef AJ talks about all the time, she said, if you have it in your environment, you're going to put it in your mouth. You want to change things, it's very simple. Clean up your refrigerator, clean up your kitchen. Just don't bring it in the house. Make it a rule that your house is your sanctuary. And I hear that so much. And it was a huge amount of conversations with my wife and my two daughters about trying to get rid of junk foods. So my wife and I and both my daughters were vegans. And the issue was that there's a difference between being vegan and then being health conscious. And our pantry had so many snacks that were just terrible. And this is an ongoing discussion, but little by little, we've started cleaning it out, and we talk about why we're doing it. What's the why on what we're choosing to do? And we talk about, what does the word vegan really mean? Why do we do it? Because we want to help people. We want to help animals. We want to help the world to be a little bit better than we found it. That's our personal choice. There's not a religion or anything behind it. We just want to make this place a little bit better. But veganism is a choice, but at the same time, there is an unhealthy vegan diet.
Absolutely. And I think you find that when you eat those vegan processed foods, you don't feel that great, or at least I personally find that. I think I always sort of talk to patients about this too. I think as you're sort of making choices with what to do with your time and what you put in your mouth, to some extent, it's almost like this cultural thing that sweets, are what we need after a hard day, or, a night of television is what we need after a hard day. And we think of those things as being restful and rejuvenating. But if you really think about what you're doing or how you feel after you've done those things, most often they're actually the opposite. So eating sugary processed foods or watching 4 hours of television, if you actually stop and think, like, do I feel rejuvenated after I've done those things? Usually the answer is no. And, potentially going for a walk or reading a book or something like that might actually provide that rest and rejuvenation that you need, as opposed to sort of what our society tells us is restful.
That is such an important point. So this brings up to the portion of the show where I get to put you on the spot. I do this to every single one of my guests, and I ask them as we come to a close to sort of, give us your top 3, 4, 5, whatever number it is. But what would you say are your top pearls on people watching this today who have learned so much about fatty liver, on what they can do, concrete items that they can do as part of their life?
I think I would just say that as you sort of start this journey to get better, that you should always just approach it with a sense of like wanting to take really good care of yourself and knowing that you're worth taking good care of. And so then as that follows, the things that are going to help you take the best care of your liver are to reduce refined carbohydrates, reduce saturated fat, and eat as many plants as you can.
Wow. I love it. That is so simple, so doable. And this message of love and this message of you are worth it. I love that. Dr. Gray, you are an awesome scientist. You're an awesome physician. We're so grateful to have you on the show, and we can't wait to have you back. Where can people learn more about you?
I have to say my social media presence is somewhat lacking, but I do have an Instagram account that's Healthy Hepatologist. Otherwise, if you're in the Alabama area, you can come and see me at UAB.
Fantastic. Well, thank you so much for joining us today.
Well, thanks so much for having me.